Hi guys, my name is Morgan. I am a registered nurse here in Lexington, Kentucky, and I work at Eastern State Hospital. I chose massage therapy for my non-opioid pain management. The first part of the assignment, we were supposed to research a news article related to the opioid epidemic, and I came across an article about a little boy. He was 5 years old from Middleton, Ohio, and he found both of his parents unconscious in the middle of the night. He ran a couple blocks down to his grandfather's house, and he told his grandfather that mommy and daddy had died. The grandfather immediately called 911, and they met police back at the house, and there police found both of the parents overdosed on heroin and the boy's little sister in a car seat screaming and crying. The dad required 1 dose of Narcan and the mom required 7. The dad actually regained consciousness there at the house, and the mom didn't regain consciousness and had to be admitted to the hospital. Both of them survived, and they both got charged with child endangerment and disorderly conduct. The boy was awarded with a badge for his bravery and for saving 3 lives. It's really sad that, you open your phones to the news or social media or a newspaper and turn on the TV and you see so many, articles now related to the opioid epidemic of so-and-so overdosing and it's absolutely devastating. Here in Kentucky, just in the past year alone, 115 Lexingtonians have died of a drug overdose. So that's not even touching on the surrounding counties. They've also doubled just in the past 3 years alone among here in Kentucky. Just a little fun fact, since we are actually talking about this. Last week, the Lexington Health Department started a program on Fridays from 11 to 1. You can pick up a free Narcan kit for anyone that needs it in the community action room at the health department. I thought that was just kind of a neat thing to share since, we are talking about that. In the nursing practice, we have all seen a drastic increase in the amount of patients who struggle with chronic pain and who deal with addiction. According to the American Nurses Association, drug-related overdose has risen steadily over the past 2 decades, becoming one of the leading causes of death in the United States. As a healthcare provider practicing on the front lines of the opioid epidemic, registered nurses, us, are qualified and well positioned to play a leading role in assessing, diagnosing, and managing patients battling addiction. The opioid crisis has not only directly affected our patient population, but it has made its way into the nursing practice as well. Nurses themselves are struggling with opioid addiction, working long hours on their feet and having direct access to opioids. This has caused an increase in workplace drug use among nurses. Addiction does not discriminate, and we are seeing it in every specialty. From pediatrics to psychiatry, we all have had an encounter with someone affected by the opioid crisis, whether it's a patient withdrawing from opioids admitted to the ER or a baby who's born addicted to heroin. As a psychiatric nurse, the majority of my patient population experiences chronic pain. The mind, emotions, and attention play an important role in the experience of pain. And patients with chronic pain, stress, fear, and depression can amplify the perception of pain. First and foremost, pain is not merely somatic. According to Assad, in an article I read, it varies according to our mental, emotional, and physical makeup. Pain perception involves many brain centers that register and modify pain signals. These include the regions involved with attention, beliefs, conditioning, mood, emotion, stress, and cognition. So when we are addressing a patient's pain, it is worth noting that attention to pain is linked to the activation of the fight or flight response and the consequent need to take action, such as escaping or avoiding it. So when we come encounter with a patient or someone in our community who, is struggling with opioid addiction. An addict's pain is relieved when they use. When heroin and oxycodone or any other opioid travels through the bloodstream to the brain, the chemicals attach to specialized proteins on the surfaces of the opiate-sensitive neurons. The linkage of these chemicals with the receptors triggers the same biochemical brain processes that reward people with feelings of pleasure when they engage in activities that promote basic life functions such as eating and sex. Opioids are prescribed therapeutically to relieve pain, but when opioids activate these reward processes in the absence of significant pain, they can motivate repeated use of the drug simply for pleasure, therefore creating an addiction. One of the brain circuits that is activated by opioids is the mesolimbic, the midbrain reward system. This system generates signals in a part of the brain called the VTA that result in the release of chemical dopamine in another part of the brain, the nucleus NAC. This release of dopamine in the nucleus causes feelings of pleasure. Other areas of the brain create a lasting reward or memory that associates these good feelings with the circumstances and environment in which they can occur. These memories are called conditioned associations, often lead to the craving for drugs when the abuser re-encounters those person, places, or things, and they drive abusers to seek out more drugs in spite of many obstacles. I chose massage therapy, and my targeted group would be my psychiatric patients. I chose massage therapy because it's something that you can also perform on yourself. And with my patient population makeup, things that are hard to access since the majority of them are homeless aren't really ideal for the population that I was gearing, a non-opioid pain management for. Massage therapy has been defined as a soft tissue manipulation by trained therapists for therapeutic purposes. A massage can be intended for one specific body part or the entire body as a whole. Massage therapy has been reported to help alleviate lower back pain, post-op pain, growing pains, leg and lower back pain in pregnant women, headaches, shoulder pain, neck pain, carpal tunnel, fibromyalgia, acute and chronic pain, and reduce inflammation. A study was conducted at Flagstaff Medical Center in Flagstaff, Arizona, and they found that patients who have been receiving one or more massage therapy sessions, averaging 30 minutes each, had a reduction in pain that was significant. Before the massage, the mean pain level reported by patients was 5.18. After the massage, the mean pain level reported was 2.33. This study showed that massage therapy created an overall positive result in the patient's ability to deal with pain. Not only was pain relieved, but patients also reported an improvement in sleep, overall emotional well-being, and relaxation. I chose massage therapy for non-opioid pain management because of its ability to not only alleviate pain, but to improve sleep, overall emotional well-being, and relaxation in patients, thus improving the patient's overall healing process. As a psychiatric nurse, we come in contact with many patients who struggle with chronic pain, who would not only benefit from pain relief, but would also greatly benefit from an improvement in sleep, emotional well-being, and relaxation. This is the handout I did. It's very simple. There's a lot of white space. A lot of my patient population has other distractions going on, whether it's hearing or seeing voices or color and all that stuff can be very overstimulating. So my handout is very plain, as you can see. It says massage therapy, and I wanted to lure you know, someone suffering from a mental illness. It's a stethoscope going to the brain. I thought that was cute. It says massage can reduce pain associated with lower back pain, post-op pain, growing pains, leg and lower pain in pregnant women, headaches, shoulder pain, neck pain, carpal tunnel, fibromyalgia, acute and chronic pain, and reduce inflammation. The benefits: alleviates pain, improves sleep, improves overall emotional well-being, relaxation, improves joint flexibility, improves range of motion. And I did do a little thing down here that says things to consider. Most massage techniques have a low risk of adverse effects. Contraindications to massage are based largely on common sense. For example, avoiding friction on burns or massage in a limb with deep vein thrombosis. And then I said, always contact your physician if you have any questions or concerns. Massage therapy should always be performed by a qualified massage therapist. And then here's a couple web pages that they can access if they want information on it. Some of the goals and outcomes I had for my patients would be to verbalize acceptable level of pain relief and ability to engage in desired activities. My patients will report pain is at a level less than 3 to 4 on a 0 to 10 rating scale. Learning objectives: patient can identify benefits of massage therapy. How to give a proper massage on yourself. Massage does not always have to be performed by a qualified massage therapist. Now, you should be properly trained, and that's where my role would come in on some techniques to, you know, massage your own wrist or your hand, or have a family member do it. Patient reports pain location, intensity, and quality when experiencing pain. Patient is educated on how to set up a massage therapy appointment in an outpatient setting if they did in fact want a qualified therapist. Patient is educated on how many sessions they will require weekly. Some people may need a daily massage on their wrist or a weekly 30-minute full body massage. Patient will be educated on how to report any new pain or an increase in pain or a change in pain. Patient will then verbalize and hopefully report a relief in pain. Patient demonstrates how to give self a proper massage, and a patient verbalizes frequency of massage therapy sessions and how to access massage therapy. And that is the summary of my teaching plan. I hope I gave you guys some fun facts, and I hope this makes everyone want to go get a massage, because it sure made me want one. I am looking forward to seeing all your all's videos and what you all chose for your non-opioid pain management. Thanks. Bye.